G'day guys, Jazz here. Welcome to the video. Now, for those of you new, my name is Jazz. I'm a consultant radiologist based in Australia. So in today's video, I'm going to talk about 5 reasons why I love radiology and to me, make it the greatest specialty there is. So reason number 1, I think the breadth of cases and the breadth of pathology that you see in radiology, you don't experience in any other specialty. If you're a cardiologist, you essentially just deal with problems of the heart all the time, same kind of conditions. No offense to any cardiologists. If you're a neurologist, you're going to be dealing with disorders of the brain all the time, etc., etc. Now, in radiology, we're kind of involved with imaging of every part of the body. And obviously in different modalities as well. So that essentially means that we're diagnosing pathologies in every system of the body, which I think is amazing. So that kind of gives you that variety. You're not seeing the same thing all the time. I just think that just makes the day interesting. And then on top of that, you've also got the scope of the work that you do in public or private. Obviously, when you're a registrar and training, like all your work, majority of it will be in a public because that's where the training sites are. But once you're a consultant, you can go private or public, it's up to you. Or most people do a bit of each. And then you kind of get exposure to even different types of conditions in the way of, acute versus chronic type of pathologies. So in the private practices, majority of them will be out in the suburbs. The patients that go there generally can walk into the practice, so they're not that sick. So a lot of the imaging that you'll be doing is kind of cancer follow-up or, a lot of MRIs of the spine or brain and all that kind of stuff. A lot of pelvic ultrasounds, etc. So there's still some interesting pathology that you see out there, but it's a lot on the chronic spectrum of things. Whereas if you decide to work in the public scenario, then naturally if you're working in a big hospital like a tertiary quaternary kind of center, you're getting all the hyperacute presentations. So all the big traumas, everything will get a scan through the emergency department. So the fun thing for radiologists being is that you get a bit of a history and then, we kind of go into, mystery solving kind of mode, look through the images, try and see what we can diagnose and, hopefully get an answer for the patient that's presented to hospital. And the pathologies there obviously being a bit more acute. You get a lot of kind of surgical pathology. So, every now and again you get acute aortic syndrome, like an aortic dissection or something like that. That's very interesting from an imaging point of view. And people relying on the radiologist to make that kind of call quite quickly in order to get the best outcome for the patient, which I think is quite cool. And then on top of that, also stroke imaging. We have stroke sequences that we run on CTs with perfusion imaging and all that. And so you're dealing with hyperacute pathologies like that as well. And then kind of everything, far in between as well. Now, reason number 2 would be the scope for diagnostic versus intervention work. So depending on what kind of a person you are, some people enjoy, diagnostic work being just interpreting scans and reporting most of your day. Versus intervention where you do a lot of kind of procedures where there's a massive scope for procedure work in radiologies, whether that's different kinds of ultrasound kind of biopsies, which is kind of the lower end of procedures, a lot of ultrasound types of drains, acidic drains, pleural drains, collection drains, and then we do a lot of CT kind of biopsies as well, whether it's a lung or other organ or bone or whatever. So there's a lot of that kind of work as well, and then it kind of goes up a bit as well. So that's kind of the scope of like a general radiologist will do that kind of basic intervention work. So the injections, biopsies, drains, etc. All general radiologists will be able to do that stuff. But it's up to you once you finish, once you're a consultant, how much of that you actually want to do. Because if you're really interested in it, then you go for more of that kind of stuff. If you're not interested, then you don't have to. But then there's also further intervention that you can do. So in the 5 years of training, you kind of learn your basic intervention stuff. But then if you want to go into the more higher end kind of stuff, which is a bit cooler, a bit riskier, you do an interventional fellowship. So that's an extra year of training after your 5 years where you just specifically learn how to do higher end intervention work. So the stuff that's usually learnt during that kind of process is a lot of vascular intervention. You'll be involved with active bleeding, could be active gut bleeding or wherever, and involved with embolizations of those vessels. So that's quite cool. So you do all that, and then, more complex lines and other, tips and all that kind of stuff, you'll learn how to do that. If you want. And then naturally for those people, they'll try and get jobs in like the bigger hospitals, and they get to do all those cool procedures on the regular. And then if that's not enough for you, then you can kind of go up another tier in neurointervention. So then you get trained up even further. You've done your interventional fellowship, and then you do an additional year or two, or maybe even more, of neurointerventional training. And those people, guys and girls, are involved with clot retrievals in acute strokes. Whoever's in the emergency department will report a stroke study. It'll be a perfusion study and be like, all right, we've got there's thrombus in whatever the MCA or something like that. And, then the next step will be to call the neurointerventionalists. They'll take the patient to their IR suite and then go ahead and with clot retrieval, and, it's, minimally invasive, kind of going through the groin and just catheters and suction catheters up to the MCA and just suck and remove that clot out. Quite impressive stuff. So there's a massive scope there, depending on what you're into. So my reason number 3 would be the option to do teleradiology, which is quite cool. So basically, once you finish your training and you're a consultant, you can take on a role. You work for a company, but you're doing all your reporting remotely for them. So you're not required to drive into a practice every day. You can work from wherever you want. You could stay home. They'll give you a workstation. You report from home. A lot of these companies will also have setups and connections overseas. So, if you feel like doing a year overseas or something like that, you want to go to Europe, they'll set you up over there as well. And the key being that, because we're qualified, like particularly for me as a radiologist with my qualifications with the Royal College in Australia, so I have no restrictions to report as a radiologist here, but obviously every other country's got their rules and different colleges, etc. But the good thing is with teleradiology, each country will have certain setups for us with different qualifications. So there'll be companies around that are looking for Australian radiologists overseas, but what we will end up doing is reporting for Australian sites. So if I'm in Europe, it'll be nighttime in Australia and it's daytime over there. And I can just report. I don't have to do any more exams or anything like that. So that's quite cool. And then I've also heard that if you really want to, you can just buy a yacht and just report off the back of that. So, if that's what you want to do, we probably do that as well. Now, number 4 would be the lifestyle. Now, don't get me wrong, radiology training itself, when you're a registrar, it's very hard. You do, long hours just like anyone else. You're doing plenty of exams, night shifts, weekends, etc. So when you're a registrar, I know there is a bit of a preconception about, what the life of a radiologist is like. It's hard work when you're a training registrar in the hospital, working as hard as anyone else. But once you become a consultant, that flexibility increases and your lifestyle can get better. It's obviously up to you how much you want to work and how little you want to work. The main thing being that if you decide to go down the private practice kind of route, then most private practices generally will just, if it's a practice that doesn't operate within private hospitals, the service will generally be kind of Monday to Friday, 9 to 5 in general. So that will be normal kind of private hours for a radiologist, which is pretty good. And then there's not really weekends or after hours or night shifts and stuff that you're used to from being a registrar. Now, you can do that kind of extra work if you want to. A lot of practices, if you're kind of opting, for that partnership route or to get involved with the business, then, that's something that you would consider doing. But obviously, there's no obligation. So it's kind of up to you if you want to do that extra work. I think that freedom there is quite good. Lifestyle is a big thumbs up. Now, reason number 5, I would have to say, is radiologists compensated quite well when you're a consultant. I think all doctors in Australia are compensated quite well. It's a long road to get to the end when you're a specialist. But I think from radiology, the bonus is kind of twofold in a way that, like, from a monetary point of view is quite good, but also in addition with, like, my previous point with the lifestyle and flexibility kind of makes it even more appealing. So, there are a lot of radiologists that don't work full time. You can work as little or as many days in the week as you want. And I don't think other specialties kind of have that same thing. Like, if you're a surgeon, I don't know of any surgeon who works 2 days a week. Like, maybe if they're close to retiring, but otherwise it's pretty unheard of. Whereas if you're a new radiologist, you could honestly go out and work for 3 days if you feel like it and have a 4-day weekend every week, and you still be doing quite well for yourself and just really enjoying life. So guys, those are my 5 reasons as to why I think radiology makes an excellent specialty. Now, if you've got any specific questions, comment down below. If you like the video, give it a thumbs up and subscribe if you're new, and I'll see you in the next one. Cheers.